Good morning. We're going to start, and I'm sure some of the people will walk in after. This session is innovative, non-zoning approaches to encourage smart growth and protect public health. This session will focus on use and regulations and other creative techniques to achieve smart growth development outcomes, incorporating public health goals into master plans and into the review of development proposals can help communities think more broadly about the health impacts of the built environment. A range of regulatory solutions will be presented, including innovative septic, subdivision, adequate facility standards, and architectural design standards. Wetland ordinances can also be applied more creatively than they have been typically. These tools can steer growth to appropriate areas while protecting sensitive natural resources and promoting healthy, walkable, and safe developments. Examples and best practices will be shared from urban, suburban, and rural communities. We're going to have 3 presenters, and after the presenters present, we're going to leave time for question and answers. And we're going to start with Cheryl Sabara. I'm going to give their bios first and then have them present all together. I'm going to give the bios all together, then have them present individually. Cheryl Sabara is the Senior Staff Attorney and Director of the Tobacco Control and Chronic Disease Prevention Program for the Massachusetts Association of Health Boards. MAHB, which is the acronym for the organization, is a non-profit membership association representing Board of Health members from the 351 local boards of health in Massachusetts. She provides legal consultation, policy guidance, and technical assistance to boards of health throughout Massachusetts. She also testifies before local government bodies on public health issues. Currently, Cheryl is working with the Department of Public Health on developing and encouraging policy initiatives to increase physical activity and nutrition using the tobacco control model. Wayne Fiden is the Planning Director for the City of Northampton, where he coordinates a wide variety of sustainability efforts. The Commonwealth has awarded Northampton the highest Commonwealth capital score, the state's measure of municipal sustainability efforts for the past 4 years. Wayne has worked on sustainability issues on 8 American Institutes of Architects Sustainable and Urban Design Assessment Teams, an Eisenhower Fellowship to Hungary, a Fulbright to South Africa, and through his small consulting practice. Wayne is also an adjunct professor at the University of Massachusetts and Westfield State College. He has numerous publications on planning and sustainability. And the last presenter will be Bruce Young. Bruce is the land use and conservation planner for the City of Northampton, where he coordinates and collaborates on a wide variety of sustainability efforts with the Conservation Commission, Community Preservation Committee, Agricultural Commission, and Energy and Sustainability Commission. Bruce has worked on sustainability issues in numerous communities in the Pioneer Valley, with the United States Navy and with the United States Peace Corps in the Gambia, Africa. These presentations will all be available after the conferences. So we'll start with Cheryl.
They should never let me go first. Okay. Good morning, folks. As Marie mentioned, my name is Cheryl Sabara, and I'm the Senior Staff Attorney with the Massachusetts Association of Health Boards. This presentation is actually a collaborative effort between myself, my colleague DJ Wilson, who's in the audience, and Leigh Susan Oyama from the Massachusetts Department of Public Health. I was asked to sort of set the stage here. Why are we interested in looking at planning if we're from the public health arena, and why are we interested in looking at public health if we're from the planning arena? And one of the biggest reasons is the next few slides that I'm going to show you. Is anyone in here familiar with these slides? They're from the Center for Disease Control. And this is really one of the first public health issues that we've really been able to track very effectively. And we've been able to do that through the Behavior Risk Survey, which is a random digit-dialed telephone survey that goes to all of our states, do it through their Department of Public Health. And it's a survey that's self-reported. So the numbers that I'm going to be showing you are really conservative estimates because they really call someone and ask them if they are overweight or obese. So you can imagine that if it's self-reporting, the numbers are probably higher than we think. In 1985, there were not a lot of states that were actually conducting this survey and asking this question. So the white states are the states where we have no data from 1985. Of those states that we do have data from, you can see in this slide that about 14% or less of the adult population self-reported that they were obese, which is being 30 pounds overweight if you are my height, 5'4". If we look at what happened in 1990, in 1990 most states were collecting the data. You'll see that there are 4 states here that did not collect the data. But of those states, we have 10 to 14% reporting that they are obese. Go 5 years down and go 5 years up. In 1995, you'll see a new color was added to the map, the dark blue. All of the states are reporting at least 10 to 14%, and as much as 15 to 19% self-reporting that they are obese. And you'll see all of the states are collecting the data at this point. In 2000, yet another color is added to the map. We have, and you'll see how the colors are changing now. Now we only have 1 state that's reporting 10 to 14%, and we have most states reporting 20% of their population or more are obese. In 2005, you can see the trend here. We have another new color is added equal to or greater than 30%. And we have most states reporting that they're at least 20 to 30% obese in 2005. 2007, which is our most current data, now you'll see what's happening here. We've actually doubled the rate of those that are reporting that they are obese. Massachusetts is the 5th leanest state in the nation, but we don't really have that much to brag about because we're still at 21% of our state is reporting that they're obese. These are adults. You can see what's happened here. We were blue, and now we have a few states reporting equal to or greater than 30%. The majority of states reporting 25 to 29%. When you look at what's happening in Massachusetts, right now in Massachusetts, and this is 2006 data from the same survey, the telephone digidial, 490, almost 500,000 of us are living with asthma. 744,000 of us have had asthma in our lifetime. 8%, or almost 400,000, have heart disease of some kind. Almost 300,000 have been diagnosed with diabetes. Another 2% undiagnosed. I'm sure you're aware of the epidemic of type 2 diabetes being reported in children. And this is very important because clearly they're our future. If these are the adults right now, if these are our statistics, and if we keep dealing with the childhood obesity and don't get a handle on that and the type 2 diabetes, these statistics are going to look even worse 10, 20 years from now. And almost 150,000 of us have had a stroke. In Massachusetts specifically, we've got 2.7 million people self-reporting that they're overweight, and we have about 100,000, or in 2007 it was 21%, which is about 100,000 of Massachusetts adults are obese. Now, we know from science that there are certain modifiable risk factors for the chronic diseases that are a result of some of the numbers that I've just given you, some of the data that I've just given you. And the modifiable risk factors are clearly what we eat, what we do, how active we are, and tobacco use. And we know with tobacco use in Massachusetts, we've seen a huge decline in smoking rates because of policy initiatives that we've implemented in Massachusetts which ultimately they were local policy initiatives that ultimately resulted in the smoke-free workplace law in 2004. Some of you may have heard that the city of Boston yesterday passed some even stricter regulations that will eventually prohibit smoking bars, cigar bars, and hookah bars. They will also prohibit selling tobacco in pharmacies and selling tobacco on college campuses in Boston. 71% of us don't eat the recommended fruits and vegetables. Half of us aren't getting regular physical activity, and the smoking rate now is around 16 to 17%. So we have made huge strides in tobacco control, but we haven't made such great strides from a public health perspective in other chronic disease prevention initiatives. So classically, we that have worked in public health try to affect individual behavior by educating, making people aware, doing early intervention. These aren't bad things, but there's only so far you can get by going to health fairs and giving out rubber wrist bracelets. It's only going to get, or coloring books. It's only going to go so far, and I've been there and done that. What's wrong with approaching it from that perspective only, from the outreach kind of perspective? And the best quote is one that Leah Susan finds. It's really unreasonable to think that people are going to change their behavior when there are so many forces that conspire against the change. And I'm going to give some examples of what they are. But what we did in tobacco control was to really look at social norming, to make smoking not the norm. Years ago, smoking was the norm. Now it clearly isn't in Massachusetts. If you travel to other parts of the world, you'll see that it is still the norm. But changing the norm is what makes it easier to choose the healthy choice instead of the unhealthy choice. Historically, when we looked at public health, back in the 1800s and the 1900s, what the main motivation for public health was clearly to deal with what the leading cause of death was. And back then, the leading cause of death was infectious disease. And that was a result of poor sanitation, bad food, bad water quality, and quite frankly, a lot of overcrowding in urban centers. So planning and public health back in the 1800s and the 1900s worked together to try to come up with a solution to ending infectious disease. And the way we thought was best, I'm saying we like I was there then, but the method that was looked at was to really separate out where people lived from where they worked. And what that did was it actually did reduce infectious disease and death rates. But it also had some unintended consequences. And the largest unintended consequence was the role that the car started playing in our society. And an interesting statistic from the Department of Transportation is that if you look at most of the trips that we take, they're less than a mile. They're either a mile or less. But 3/4 of those trips are taken by using a car. The number of trips that we take on foot has dropped by 42% over the years. So now what public health is seeing is that the current preventable leading causes of death are really lifestyle diseases. They're the diseases that result due to the maps that I showed you and the statistics that I showed you from Massachusetts. Cardiovascular, diabetes, obesity, osteoporosis. These kinds of diseases, while clearly there are some genetic components to these diseases, the genetic component is minimal if you look at the rapid doubling of the obesity rates and of the chronic disease rates. So, as I mentioned, most suburbs are built with the car in mind. And we've clearly seen an increase in car accidents, in pedestrian injuries, and we've seen at the same time a real decrease in our physical activity and a decrease in really our ability to just socialize with the people that we live around. So one of the goals of what we're all doing now is to try to undo what we did. I mean, our motives were honorable, and we did succeed in ridding ourselves of a lot of the infectious diseases, especially if you add vaccinations, cetera, to the equation. But we now need to start to bring back the things that we had separated for so long and start looking at initiatives that will actually increase physical activity and healthy eating. And what the Department of Public Health asked us to do was to look at what we did in tobacco control with the changing of the social norms and try to find a way to do that with chronic disease initiatives. And what we did in tobacco control was we looked at the authority, the legal authority that local boards of health had, and now we're also adding the legal authority of planning boards, of town meeting, of zoning boards of appeal, and we started to look at what kind of policy changes could we do locally. And one of the first ones we started with was actually enforcing a state law that prohibited the sale of tobacco to minors. It was doable because nobody wanted kids to be able to purchase cigarettes. So there wasn't a real reach there. It was a comfortable kind of initiative for local boards of health to start getting involved in. And it was also something, if you're working locally, you don't have the same lobbying pressures that you had when you're trying to pass a state law. For instance, we didn't see any lobbyists from Philip Morris at the Sutton Board of Health. We saw them every time we went to the State House, and you could tell who they were because they were the ones that were dressed way better than we were. But you didn't see them in your cities and towns because they would have stood up. So we were able to start looking at policy initiatives that we could do locally, and we did so many of them that we got to the point where we were able to help pass a statewide law. That's what we're trying to do now with chronic disease. It's more challenging because, you know, with tobacco, there was get rid of tobacco or get rid of secondhand smoke. It was tangible. With chronic disease, it's so broad that it took us a while to really figure out, to tease out what are some doable initiatives. And what we decided in collaboration with the Department of Public Health is that we probably could make a really strong case for helping create development in cities and towns that actually encouraged physical activity and encouraged healthy eating. So I'm going to go through some of the, I'm not going to go into detail on a lot of these. I'm going to go into a little bit of detail on two of them. But active living is a term that I'm sure a lot of you have heard. Look at your recreation departments. Look at your open space plans. Make sure that your city or town is encouraging walking and biking. And try to find ways to decrease the dependence on cars. Make it so that it's really easy to walk to the bank or to walk to school. Encourage, and we'll go through the healthy eating in a minute. But for my membership is boards of health, the 351 local boards of health that exist in the Commonwealth. We've created two tools that are now being passed or being looked at by local boards of health. One is a resolution, and one is a development checklist, and we'll go through those in a minute. And these slides you'll all have so you can see what's in these bullets. I'm not going to go through them in any great detail, but something as simple as placing benches and resting places at regular intervals so seniors feel comfortable walking to the bank or walking to the hairdresser. Safe routes to schools is a statewide, a nationwide initiative that I'm sure a lot of you are familiar with. But make sure that sidewalks are cleaned so that your students, our kids can walk to school safely. See if there's a sidewalk committee in your city or town to see whether the sidewalks are maintained. Look at pedestrian safety issues. We often don't look at injury as a bar to physical activity, but if your roads and your sidewalks and your bike paths aren't maintained, then who on earth is going to want to use them? Look at traffic calming measures so that cars aren't going so fast that people are afraid to cross the street. I just came back from California last week, and everyone thinks California was so innovative. We heard about what California was doing today. It's great, but it's a state that's so motivated by automobiles. If you push a button to to cross the street and the little white guy comes up, he's up for about 2.5 seconds. You're not even halfway across the street. So look at those kinds of things that can really be done pretty easily by a city or town to encourage folks to get out and walk where they need to go. Healthy eating, attracting grocery stores. You know, when you're in areas, especially large urban areas, very frequently there's just no option of finding fresh fruits and vegetables. You only have convenience stores that sell canned or packaged foods. Look at vending machines, and these are things that local boards of health and local government can do pretty easily. What's in the vending machine in your town hall or in your schools? Do you have any menu labeling regulations, which is something that's being done in other states and is being looked at in Massachusetts? Do you have a regulation that bans trans fats? That's something that the city of Boston is looking at, Newton's done it, and other municipalities are looking at it. Back to the resolution and the checklist and other initiatives that local boards of health can do and sometimes don't even know that they have the authority to do. Every city or town that has more than 10,000 residents has to have a planning board. And you can have a planning board in cities and towns that are smaller than 10,000 residents. Every planning board is responsible by law for creating a master plan of that city or town. And that master plan encompasses strategies that that city or town want to use for land use, policies, plans for the long-term management and development of growth in that municipality. There's no reason that Board of Health members or other public health interested residents of a city or town can't get on that master planning committee. These master plans are living documents. They're amended from time to time, and a committee is formed in order to amend them. There's no reason that public health shouldn't be addressed in that master plan. A lot of times it may be addressed implicitly, but not explicitly. And there are ways to have public health addressed explicitly in master plans. Folks don't always think of that master plan as an avenue for addressing public health in a community. In fact, there have been anecdotal examples of a Board of Health member calling up the planning committee and being told, this is a master plan, it doesn't have anything to do with public health. Yeah. But then there are also anecdotal stories where in Stowe, Massachusetts, the chair of the Board of Health is also the chair of the master planning committee. So it can work in different ways, and it's really important to think about public health when you're thinking about managing the future growth of the community. And DPH has lots of region-specific data on, like the data I gave you on diabetes, on obesity, on chronic disease. That data can be broken down in ways that will be usable for your city or town. And you only need to contact the Department of Public Health. Maria is one of the community liaisons that's able to get that data for you. And there are other folks that work in different regions of the state that can get you region-specific data that will be helpful in making the case for why public health needs to be considered. Master plans, in some of these master plans you can see online. Some of you are way more familiar with them than I am, but you can advocate for a section on town centers. For instance, concentrating the businesses and the services in the town center. Trying to cite schools, if schools are being built, in areas that kids can walk to instead of on the outskirts of town, where when you end up with a budget crisis like the town of Randolph did, their schools were outlying the town and they had no buses to bring the kids to school, and it created a huge problem. Whereas if the schools had been sited closer to the center of town, they wouldn't have had the same challenges that they had. You can also put in sections that address parks, open space, transportation, that encourage the kind of issues that we're looking at right now that would increase physical activity. The resolution is a document that has absolutely no legal benefit at all. It's not an enforceable document, it's not a law. It is what it's called. It's a resolution that a Board of Health can enact that goal is to plan for a healthier, the title of the one that we created is Planning for a Healthier Future Through the Built Environment and Community Design. And the purpose behind it is to get public health to the table before developers have spent tons and tons and tons and tons of money on plans. It basically puts the developer on notice that in X town, we're going to look at your development and we're going to see whether it encourages physical activity and, if applicable, healthy eating. And it starts with a preamble that's the second bullet. Decades of evidence indicate that there is a relationship between land use planning decisions and public health outcomes. Now, we've cited, we've put endnotes on it so that everything that we cite in this document is attributable to someone much smarter than we are, that's actually done the research on these issues. It also says the planning department and the health department can work together to improve the community's health through changes to its built environment. As I said, this doesn't have any legal, it's not legally binding on anyone, but it does put everyone in the town on notice that these issues are important to this town. And then we go through the evidence that of the decrease in physical activity levels, the increase in overweight and obesity and in chronic disease, and the need for less cars. And again, as I said, it's evidence plenty. And it encourages smarter development strategies. Okay, I'm going to just finish up here. The checklist is another document, and again, I have one copy of each. I'm happy to email it to anyone who's interested in it. It basically gives planning boards a document that they can use if they so choose, and I know Bedford's planning board is using it right now, to look at issues to see whether there is connectivity, how wide is the street, what's the block length, are there traffic calming measures, are there trees? So there, I don't know what trials are. I need an error there under healthy choice. Trails! Oh, I just spelled it wrong, sorry. So these are just all on a checklist, and again, they don't have any legal effect. What they are is they're the beginnings of looking at policy change. They're the beginnings of having boards of health and planning boards really look at how they can work together to make their city or town healthy. Role of public health, you know, these are all the disciplines that public health has to or should be playing with. Public health brings data. When we started doing this work with planning boards and with regional planning agencies, it dawned on we have similar goals, but public health can supply data that can drive some of this, so that selectmen, town managers, mayors, city councils can actually see the benefit of doing built environment, smart growth kind of strategies, because public health supports it with their data. So, other people that you would be working on, I'm going to finish up. There's my contact information, and again, this was in collaboration with Leah, Susan, and DJ. Any information you want, just let me know, and I can give you their contact information as well.
Thanks. So my job is to be meaner. My job is really to talk about sort of what are the regulatory tools that implement some of these things. Let me just start. I had a minor epiphany this morning. How many of you, when you came upstairs for registration, rode the escalator? Okay. So I was next to Maria, who walked up the steps, and I rode the escalator, of course. So, I mean, I'm a big believer in public choice. One of my concerns when I travel around the country is, in a lot of places in the country, there's only the equivalent of an escalator. There isn't an equivalent of walking. And so, doing the steps of making walking pedestrian friendly, doing all those steps we can do are half the battle. But we all see sometimes we can't just be nice and provide the good infrastructure. Sometimes we have to start encouraging and using regulations a little bit to encourage the sort of smart growth activities that we're looking for. I'm not going to talk about the biggest regulatory tool that's out there at local government levels, which is zoning. it's obvious. There's lots of sessions here today on that, so I'm going to ignore that. But know that most communities who are focusing on smart growth are using zoning and are encouraging live workspace, their downtowns, and walkable villages, and all this wonderful variety of things. The point I'm really going to talk about is there's lots of other tools that are out there that we're ignoring. And really, to some extent, every single regulatory tool we use could be a tool for smart growth. So I'm going to go through some examples. I'm going to focus primarily on projects that I've been involved with. I'm planning director in Northampton, so a lot of these examples from Northampton, some are examples from other communities I've worked with. So first I'm going to talk about subdivision regulations, which are one of the most important tools, particularly for areas that are still growing. Boston hasn't had a subdivision, I'm sure, in 50 years. But for any area that still has raw land which is being developed, subdivisions is the set of regulations that determines how roads get built. And if you look at subdivision regulations around the Commonwealth and around the country, you're going to find an awful lot of those rules is just about how roads get built. And maybe the drainage goes in, whether you have fiber optic cables. But subdivision regulations really are a cookbook. It says, here's what we want the public realm to look like. And so we can focus on anything we want in the public realm. This is one of my favorite slides. This is from Longview, Washington. Longview, Washington loves their squirrels. They have a 7-foot statue of a squirrel. They think they're really important. They have this beautiful town common you can only get to by crossing 4 lanes of fast-moving traffic. So they built a squirrel bridge. Never mind, the people can't get to it. The squirrels are safe. So obviously part of the question is, how do we try to make people as safe as we make squirrels for doing? And so some of these I'm talking about apply to subdivisions, but apply to other kinds of regulations as well. The first is sort of the term that's in favor these days is the complete streets approach, saying streets are a means of transportation for all modes of transportation. They do need to be friendly for cars, they need to work for cars. They do need to be friendly for trucks, but they also need to be friendly first and hopefully foremost for bicycles and for pedestrians. So how do we design the streets so that's part of it? We're going through, in my own community, we're going through this debate right now of how much money gets spent on sidewalks and bike paths. And the bike path community is saying, more and more, we need more money for this. And how much money is spent on roads, which we're just going traditionally. And a lot of us say, no, those are false arguments. What we really need to say is, every time you touch a street, we need to look at the entire street and make sure it's balanced. Same thing goes on the regulatory side. Every time you create a new street, you make sure it's balanced. Likewise, smart growth isn't just about health issues and obesity and where people live. It's also about the environment. And so a lot of focus on low-impact development. There's a whole workshop here today on low-impact development. But we started looking at subdivision regulations. I've worked with about 8 other towns, helping them with subdivision regulations, to think about, what is low-impact development? How do you get the water off the streets, off people's roofs, and put it back into the ground so it doesn't run off and cause erosion? And some of the mechanisms are obvious. Some of the mechanisms are, what's the engineering infrastructure we want for these projects? But some aren't so obvious. This is the, how do you get people off the escalator? So in Northampton, we said recently we want every curb in a subdivision that uses traditional drainage systems to be granite. And we say it's great for the environment because granite curbs last forever and doesn't use bituminous products and lots of good reasons for doing it. It looks better in an urban area. But it's also, frankly, very expensive. And that's fine with us, because what we're saying is, if you're not going to do low-impact development, we expect granite curbs. If you do low-impact development and take the water off the roads in other ways, you don't need the granite curbs. So it starts balancing the equation and encourages developers to go that direction. Again, from an environmental standpoint, we started thinking about how do we design our subdivisions that are in rural areas and suburban areas. And for all that I like town centers, lots of development is still going out in those areas. How do we define the projects that go on out there to be amphibian friendly, or whatever the animals that are worried about? So we focused on, okay, when there are curbs, are the curbs vertical or horizontal? Are we putting tunnels in? What's the layout of these projects in our subdivisions? Likewise, one of the things we've done very recently is we looked at fire flow. If you look at almost any suburban or rural community in the state, the subdivision regulations were written on the sort of an engineer's reality. They say, well, where's their water pressure? There's water pressure in villages, there's water pressure in town centers. So we have to be really tough in those areas. We meet ISO standards. We say we need 500 gallons a minute against 20 psi, or if you have dense development, we need 750 gallons a minute against 20 psi. Those of you who are planners know what all this stuff means. And then we say in those outlying areas, oh, we can't do it, oh well, maybe put a fire pond in. And so we've tried to reverse that by saying, well, we expect 750 gallons of flow against 20 psi everywhere. And we're not opposed to development in the outlying areas. No, of course that's not it. We're worried about fires. And we just don't expect our taxpayers to be subsidized as having to buy new fire trucks who drive 10 miles out to watch their house burn down. When we make people who live in our town centers, you know, be close to the fire department all this way. So it is a sort of balance thing. Let's use, instead of encouraging suburban development, which most of our subdivision regulations do, by having less stringent fire flow standards, we're using the same standards everywhere. Likewise, I'm going to go through this list. You can imagine in every sort of project that gets built, even though cluster, affordable housing, open space, land use, those are all traditionally the realm of zoning. Subdivision regulations have a lot to do with those things. So for example, it's not uncommon for towns to say, we like cluster, it's our preferred mode of development in rural and suburban areas. If you're not going to do cluster, we expect you to do an alternatives assessment to at least think about cluster. If you are doing cluster, you don't have to do alternatives assessment. For affordable housing, most developments end up getting some waivers from subdivision regulations. So even though we can't require affordable housing, what Northampton says is we're currently 11.9% affordable housing. If you're doing a subdivision and if you're asking for any waivers, you have to give us at least 11.9% affordable housing. Almost every project asks for some waivers. Almost every project in Northampton is now giving us 11.9% affordable housing. I've worked in hill towns who've done the same approach with open space. You know, we only give you a waiver that's certain amount of open space associated with it. And then likewise, how much infrastructure a developer pays will be a big factor in where they develop their project. So a lot of developers are telling us, you know, we've got the message from Northampton. You don't want us to build in rural and suburban areas. You made infrastructure really expensive there. We're beginning to refocus on places closer to downtown. So subdivision regs are the biggest kind of tool we often use, but there's other regulatory mechanisms you can do. The first is something that most states, Maryland in particular, calls adequate facilities. Florida does basically the same thing, calls it concurrency, and basically says you can't develop until the infrastructure is ready to deal with the development that's there. And you can do this through zoning regulations, you can do this through subdivision regulations. In Massachusetts, we're a home rule state, you can do it through a separate bylaw or ordinance. So it doesn't have to be in zoning, it doesn't have to be in subdivision regs. And the idea is to say, when we're getting what's called premature subdivisions, when people are building a land before the infrastructure is there, they have to build densities that are low enough to accommodate septic systems. They have to build densities that are low enough to accommodate fire ponds. And once those homes are platted out, 2-acre lots, 3-acre lots, 4-acre lots, they will probably never change. And so if you are really allowing or even encouraging those sort of premature subdivisions, then you've created a suburban pattern of sprawl that you basically can never change. You still see this very close to Boston. And so increasingly communities are saying, okay, you can build where you want to build. We do believe in public choice, but we still want the water lines that are out there. We still want the granite curbs. We still want the concrete sidewalks. So in Northampton, if you want to build in a suburban area, you can, but we will expect concrete sidewalks on both sides of the road and granite curbs and water pressure that meets more urban standards. And frankly, if you have 170 feet of frontage, it's hard to pay for all that stuff. And so it encourages people to build where we only have 40 feet of frontage or 65 feet of frontage. The next one is not traditionally used to think about smart growth is septic system regulations. This is my experience in a different community, not in Northampton, but a community that's thinking about this, which is to use septic system regulations to encourage smart growth. So traditionally, septic system regulations are one of the cores of boards of health too. You know, before Cheryl started doing the roadshow and telling boards of health, think outside the box. Health regulations are more than just about, you know, mosquitoes and septic systems and restaurants. This was, you know, one of the trilogy of what boards of health do. We care about nutrients. We don't want contaminated groundwater. We don't want pathogens. We don't want heavy metals. All that stuff is pretty obvious. This is a picture of a raw sewer in Mexico. And a picture of an algal bloom in northern Michigan. But the reason I became a planner was really mostly because of this slide. I worked in Vermont for 8 years designing septic systems, working with small towns, helping them administer their board of health regulations. And I quickly discovered that I was designing a lot of septic systems on agricultural fields. That's a system that I did on a big agricultural field. And so I felt like, okay, am I becoming part of the problem? Here we're trying to preserve the environment, which is really important, but are we becoming part of the problem instead of part of the solution? And in Vermont, it's particularly funny because I do some of these systems in Addison County, which is along Lake Champlain, and we make people use an enormous amount of farmland to build these big systems to deal with nitrogen. Because we could do systems that dealt with phosphorus, we could do systems that dealt with pathogens, we could do systems that dealt with man-made organics. This is all about nitrogen. And while we're building a system, 40 cows wander through here, dumping a lot of nitrogen on the ground. And so a lot of our septic system regulations are really about nitrogen, which is almost impossible to treat anyway from septic system regulations. So one of the communities I worked with said, well, maybe what we really want to do is we want to think about the broader environmental footprint. If I have 20 acres of land and build my house right in the middle of the property, have a long driveway and big lawn and lots of opportunities for antifreeze to drip from my car and destroy sort of a natural system where it rains, the water goes into the ground, my environmental footprint is probably going to be pretty big. Are there incentives we can put in septic system regulations to encourage those systems, those homes to be at the edge of the property and closer to the road? And in Massachusetts, Title V sets a minimum standard, so no one's talking about changing the Title V standard. But at least in this one community, they were thinking they're much stricter in the depth of groundwater. Maybe what they say is in the middle of the property, they meet their much stricter depth of groundwater standard. And the edge of the property would still meet Title V, but not have this extra set of regulations. So it's that bigger environmental footprint challenge. One of the big challenges in Massachusetts is that we're very balkanized. I did a project recently in Louisiana, which is no one's model of smart growth regulations. But Louisiana allows what's called a unified development ordinance. You want to know what the regulations are in central Louisiana where it's doing a project. You can open up the unified development regulations and you know what the regulations are. In Massachusetts, we have the Board of Health, we have the Conservation Commission, the Planning Board. We have dozens of different regulations which sometimes disagree with each other. And they don't always work together, and so it forces us into little boxes. The Board of Health says, well, we can't let nitrogen from septic systems go in the groundwater. But the result may be we actually get more nitrogen from fertilizers going in the groundwater. So how do we make these things work together? So other kind of regulations, I'll run through this quickly, is design standards. A lot of people do design standards through zoning, but in Massachusetts it's very limited what you can do. Some people do design standards through historic districts. Again, you're somewhat limited. Northampton, Cambridge, a couple of communities have home rule architectural ordinances, which say we're trying to preserve historic buildings, but maybe equally important, if not more important, we're trying to make sure that the new buildings are friendly for pedestrians and friendly for the street. How do you get people not to ride the escalator, but to walk instead, not to go in their cars, but to walk instead, make the streets more alive? And so, really focus on the design is important. Personally, I think often design is more important than the uses are. Final regulatory action I have that we actually do as an ordinance, something Northampton's considering right now. We have a policy in our comprehensive plan which says all new buildings, all new municipal buildings will be LEED certified. All municipal cars, we look at hybrid vehicles to see if it works. For diesel vehicles, the fire department look at biodiesel to see if that works. Great policy works. We built one LEED certified building 2 years ago. We have a police station about to break ground. But it's not an ordinance, and so the current mayor could leave, the next mayor could come in, the next mayor could say, oh, this doesn't work, we can't do this. So we talk about taking the same policies and just codifying them so that it really becomes binding on us. Then two last things to go over quickly. These aren't really regulations per se, but they're sort of quasi-regulatory, so I put them in the slideshow. First is obviously brownfields development. This is regulatory in the sense that the Commonwealth and the federal government have strict environmental regulations about reuse of sites that are contaminated because of hazardous waste. We've looked at a few projects in Northampton, 4 now, where we've looked at these buildings that aren't being redeveloped because of the real or perceived environmental contamination. And we've looked at what are the actions that the city can do to get those properties moving again. Bringing grants, giving regulatory relief, giving tax credit relief, to get the projects back on the tax roll. Because for the most part, these brownfield sites, the areas which used to be developed and are good models of development, and people often walked away from them because the site was too challenging. Finally, the same line, open space. Obviously, most towns use open space and think of it as part of their smart growth strategy. We've done that. We've also looked at open space a slightly different way. We've looked at where do we think the private sector is failing to develop property correctly. As developing, the private sector might develop properties in ways that are really damaging to the environment. So, you know, we looked at an 80-acre tract of land. We did assessments that where would a private developer develop the property? There's a beautiful knoll in the middle of the property, great place for homes and views, but absolutely the worst place from an environmental standpoint. So we got involved and basically did our own limited development, where we'd buy that 80 acres of property. We'd only do it if the neighborhood really wanted the limited development. And we'd go to the neighbor and say, how about 2 homes along the road, identify where they are. And then we'd get as we preserve the land, and we get the homes in the right place. We've done, I think, 8 of these. We've had 2 other ones where we offered to the neighborhood, and the neighborhood didn't want to do it. They thought they could convince the developer not to build anything. We said, fine, have a great time. But we sort of use this as a tool to when we can build consensus to move forward. Thank you.
Young, and this is the first time I've spoken at a conference with the director of my program here next to me, so if he starts to cringe, please let me know. I'm sorry. Okay, so I'm going to talk about a non-zoning smart growth tool that is actually somewhat based on zoning. And that's the Northampton Wetlands Ordinance, which was adopted by the amendments to the ordinance were adopted by City Council in 2007 in October. So it's, it's fairly new for us. And what I'm going to do is talk a little bit about the background, the research, kind of the circuitous path that we took to get where we are, a little bit about the integration of the added protection that we put on our existing ordinance, and the smart growth initiatives that were somewhat based on zoning, and then the challenges that we face ahead of us. So start here. This is Northampton. This is a very simple map. It's kind of it's what I meditate to when it gets a little hectic in our office. It's basically Northampton, the outline, and then the buildings in Northampton. You'll see we have a downtown kind of core here. It's a pretty traditional New England town. We have a core area here for downtown, where it's maybe not traditional as we have 3 villages. We have core downtown here, we have a little village here, and then we have a little village up here. Pretty much we've done a good job keeping the development in the downtown areas, but our wetlands ordinance that was passed in 1989 left a lot of discretion up to the Conservation Commission. And it worked well through some of the 90s when there was a lot of kind of flat, open, dry land. And the commission had easy decisions to make, and developers were using that land. Toward the end of the 90s, early 2000s, we started seeing more unique projects, projects that were built on steeper slopes or being proposed on steeper slopes and in wet areas. So areas like this, we had these nice open wetlands. Let me go back and say, these are kind of our open areas here. That's open space, pretty much contiguous open forest. That area there, some area down here and some here. you can see that some suburban development is starting to move out this way and along these roads. So we had areas like this, kind of wet meadow, and what we were seeing is developments like this, where we get a proposal that would come in front of us, and it would be a subdivision. It would completely encircle a wetland, and then it would be up to the Conservation Commission to use their discretion to say, no, we want it a little bit further back, and then a developer would kind of say, well, we can't go that far back, and it would be back and forth. And basically what was happening is the Conservation Commission was spending a lot of time redesigning projects. And the developers who would propose a development would consider it unfair, unpredictable, and costly to continuously have these back and forth redesigns with the Conservation Commission. So originally, what we did is we said we want to update this ordinance, and how we want to do that is we want to kind of put a no disturb line on our ordinance, and a few other communities in the Commonwealth have done this. They put a no disturb line, so it's a little more predictable for developers. They've said at 35 feet, no project can go closer to a wetland than 35 feet, or 50 feet, or 20 feet, or whatever it is, depending on the area. So Northampton started looking at this, and they said, how can we incorporate this and make it work for Northampton? So we started coming up with numbers. What if we use 50 feet, and we say, no project can go closer to 50 feet. That protects all of our natural resources, at least to 50 feet. And so then we started looking at some of our developments, suburban developments around town, and we said, it just wouldn't work for this. We have all these houses that are already closer than 50 feet, some of them that are built on wetlands, and then at the same time, if we said, okay, well, this doesn't work for 50 feet, what about if we went with 20 feet? And so then 20 feet, we started saying, well, maybe that's a good line. Let's look at the scientific literature. Let's try 20 feet. And then we started looking at some of our outlying areas where they're very rural, and we have 100-acre parcels. And would it be fair to this wetland or this resource area to say, go ahead and build up to 20 feet when you have 100 acres to build in front of it? So this is kind of a challenge that we're dealing with. We weren't quite sure where to go with it. We didn't see anything out there that was kind of leading us in the right direction to protect our resources and kind of at the same time make it fair and reasonable as a process for development. So what we started to do is we started doing more research, and we looked at what's the recent development in 5 years, where is it? And you can see most of it's out here in the outlying areas, and there's a little bit down in the downtown areas. And then we looked at our water resource areas, and we said, okay, where are our most important resource areas? Where are our rivers? Our rivers have protection under the Mass Rivers Protection Act, so maybe we don't want to go there. What are our other resources that are important? And we said vernal pools and wetlands and intermittent streams. And so we started looking at these and inventorying them and prioritizing them. And we said, okay, so now we have this, we know where the development is occurring, we know what resources are important, and then what came out of that is whatever we do from this point forward, we want to separate wetlands and vernal pools. So we want to protect vernal pools. They're the most important habitat in Northampton. Everyone agreed to that. And then wetlands are also important, but one thing that came out of this is that not all wetlands are equal. So we're kind of putting all this together, and we're not sure where we're going. At the same time, that's Wayne there. Northampton was starting to work on the Sustainable Northampton Plan, which is a master plan that Cheryl talked about. And out of that master plan, we had several public forums, and there's a lot of information that came out of that. And one thing that came out is some basic kind of smart growth principles, that the city and the people want to adopt land use patterns that maintain that mix of urban, rural. They want to concentrate development in existing neighborhoods and existing villages. And they want development to occur near public transit. They want it to be efficient and promote energy efficiency and protect the environment, open space, and agricultural resources. And so at the same time, all this information is going through the Conservation Commission as how we're going to protect our resources. The Northampton plan was saying, we want you to protect your resources, but we also want you to somehow protect them and put them into a sustainable, smart growth format. And it took a while, but we came out with, we decided we'd start by looking at zoning, which was pretty easy. It's already in place, and most decisions are already made on zoning. So we started looking at the zoning map for the city, and didn't quite know what to do. There are 15 zones. It's pretty complicated. There's highway, business, medical. And so after a little while, we broke it down into 3 different types of zones, basically, or 3 different types of areas in the city. We started first with the commercial industrial as an infill area. So most of this is along in the downtown areas. And then we had an industrial park and a industrial kind of corridor here. So we said, okay, we'll break our zoning down into commercial industrial and then urban residential. Basically where all these are urban areas that people live, but they surround the core downtown industrial and commercial areas. If you remember back at the first slide of Northampton, almost all the buildings are in this area, and then there's some sprawl coming off of it. And then the third thing is, what we did is we said, okay, last but not least, we'll say these are our suburban and rural areas with mostly open space, and the priority kind of habitat areas where we have our vernal pools, where we have our wetlands that are actual wetland systems, not just isolated wetlands found in an urban core. So once we did all of this, we then said, now where do we go? How do we adopt smart growth principles and protect our wetlands? We still want to put that line in the sand to make it fair for developers and protect our resources. And so what we did is we said, let's look at what we've permitted in all of these zones and what we've allowed in these zones. So we looked at the commercial and industrial area, and we took all the permits and we said, how close have we allowed people to build to wetlands? And then we looked at urban residential, and we took the outliers out and we said, what are the majority of the permits? How close did we allow people to go? And where are our houses located? Where are our buildings located? And then we did the same for the suburban and rural residential areas. And what we came up with is, for the industrial and commercial zoning districts, most of the buildings were actually within 10 feet of the wetlands that are located there. Many of these areas, like the industrial park, is actually just built on wetlands. It was done 40 years ago. Many of the downtown areas are located within 10 feet, and we said, okay, the Massachusetts Wetlands Protection Act has a buffer zone of 100 feet to 0 feet. And sometimes you can build within a wetland. You can actually fill with 5,000 square feet. The committee said, we don't want to lose any wetland. We think all wetlands are important. But we do want to see development happen in these industrial areas that are already built up. We want to see infill development. We want to see people building near infrastructure, near transportation, and but we still want to protect that wetland, so we'll draw the line in the sand at 10 feet for this area of the city, and we'll call it infill. Then we looked at urban residential B and C. Those are basically the areas where most people are living. They're close to downtown. You'll see some suburban areas out here that are pretty dense, but most of the densest neighborhoods in the city are in here. And we said, same thing, where are people living? Where are their houses located? If we wanted infill development between two homes, what could we permit? What has been permitted? And what we came up with is a 35-foot no encroachment zone, or a line in the sand. So basically we would say to someone who came in front of us, now the commission has discretion between 35 feet and 100 feet. So developers they now know when they come forward that they can go no closer to 35 feet. And there were some provisions in the actual ordinance that said, with extraordinary measures, we may allow you to go closer in this zone, up to 10 feet. And so that gave the commission a little more discretion, but it put the onus on the developer, and it was pretty clear and straightforward and fair. And then we looked at the biggest part of the city, which was pretty much all suburban and rural, mostly rural. And these are where our large wetland systems are, where our vernal pools are located. And we said, we want the line in the sand to be at 50 feet. We don't want to impact habitat out here, and we don't want to destroy these systems by allowing development to slowly surround wetlands and basically ruin that system. So basically we came up with a 3-tiered system, protects the wetlands, draws a line in the sand that's fair for developers, and then also guides growth towards the existing infill areas. So then we basically did the same thing for vernal pools. And this is what was most contentious. What the Conservation Commission said is, we think vernal pools are the most important resource area in the entire city. We want a 200-foot protection around all vernal pools. And so we, in the planning office, said, that's what you want, we'll write that up. And we wrote that up, and then people started coming out of the woodwork to the meetings saying, 200 feet is a huge amount of land that you're taking away from development value. And they said, we don't want 200 feet. And then after many meetings between environmental groups, business groups, all sorts of interest groups, neighborhood groups, they came up with a compromise that the infill areas would have the state protection for vernal pools, or certified vernal pools. So we would say to someone, again, we're trying to get you to build within those infill areas. We'll waive the standards of this ordinance for these infill areas. But in the outlying areas, the suburban and rural residential, we want 200 feet of protection around these critical systems. And that actually passed after many iterations and a lot of discussion. So right now, basically there's a 200-foot protection with some minor exemptions for the 0 to 100 feet. You could put, say, a utility line, your sewer line, which is a temporary disturbance. And 100 to 200 feet, you could put an actual driveway, but not a structure that's going to impact the system. So once we got there, now we're kind of making decisions based on this, and we have some serious challenges ahead of us. And one is this, and I think I was at a stormwater conference, and I think they call these HIGs, holes in the ground. And so what we're saying is we want good infill development, but through our wetlands ordinance, we didn't really adopt stormwater standards that would improve the stormwater in these infill areas. So we have a challenge to come up with better design standards for stormwater instead of these giant holes in the ground, and to actually require or implement some or incentivize low impact development type of stormwater systems. And then the second thing goes with stormwater systems is maintenance. And we're working with the Department of Public Works, who now has a stormwater manager, and we're setting up maintenance for these systems. But some of these are older systems, and some of these have been approved under a system that didn't have basically monitoring for these type of systems. And this is what we're seeing. And then finally, Wayne had mentioned this early, design standards and architectural ordinances. We really need to think about how the infill happens. Because if we're saying we want a house between two houses and we can't get the neighborhood to buy onto houses that are just not helping the neighborhood, I guess. And then the last slide is another challenge that we're seeing now is these urban wetlands that we're allowing growth to occur closer to typically do not provide habitat, a lot of habitat, or even quality habitat. We say they do provide some habitat. They're usually better for stormwater retention and other functions. But some of them do have habitat. And recently we've had, over the past 2 years, we've had some urban beavers that have flooded some basements, and we had about a couple hundred homes that could have been severely impacted by large dams. We're not really interested in just killing animals, so we've been working with beaver receivers, and it takes a lot of maintenance. And so we have some challenges ahead of us, but so far I think it's working, and it is guiding growth in the right direction. And I guess I'll end it there and leave some time for questions.
So, we have about 10 minutes for questions, so, yeah.
Hi, I actually have 3 questions. The first is unified plan in Louisiana, was that pre or post Katrina?
Their regulatory structure is less bifurcated than ours is. So towns can write ordinances and bylaws and put the regulations wherever they want. You don't have to say here's conservation and here's zoning. Now, that said, Louisiana may not in fact regulate conservation, but if they wanted to regulate conservation and give the planning board that charge, they could do that. If they wanted to write their own building code, they would have to wait for the state to do it. But that hasn't changed since Katrina.
Okay. And then in the case of the open space and limited development, was Northampton purchasing the open space, or were they acting as a liaison between the developer and the property owners?
We've done both. It's when we can make the timing work, because we don't build things, obviously we're doing permit stuff. When we can make the timing work, what we've gotten is we have a property under auction, and then during the auction period, we do the due diligence, we do the permitting, and we find a seller for the lot. And then technically, the current property owner sells the building lots to one person and sells us the open space. But it sells us the open space at a dramatic discount if we found a buyer. So we tried that. We had some times where we had, the nature of the deal didn't allow that. We had to buy the entire property and then sell it. And because of the bureaucracy, it's slower, we have to go more formal art. When we're getting them the permits and they sell the property, we don't have to deal with the procurement requirements. When we take the property and then sell it, it's a normal, procurement process.
Okay, and then my last question is regarding the wetlands ordinance. Curious this is more a philosophical question, what your thoughts are on the zoning reform argument that overly restricted wetland regulations have a causal relationship with the low availability of affordable housing in Massachusetts.
Good question. I think there's potential for that, but I think in this case it allows for development in the right place where there is room, and it frees up open space and resources where maybe development shouldn't occur and may end up costing the taxpayers more in the future. Those areas are outside of the existing infrastructure now, and it ends up costing more money to extend the infrastructure, repave the roads, busing children from far distances. So I think it's potential it drives up the price in those areas, but I think it's a good trade-off.
Can I just add one thing to that, which is, as a state, we do so much that drives up the cost of housing that isn't necessarily protecting the environment, that, you know, the number of communities close to Boston have 2-acre zoning or 1.5-acre zoning is absolutely absurd. So I think you can do an enormous amount to address legitimate issues of the housing being too expensive without having to get to, you know, core environmental issues.
Wayne, as a impressive list of strategies for describing, is there any particular state action that would facilitate your use of those strategies locally or indirectly, whatever? And is there any state action that would incentivize other communities around the state to adopt a similar approach?
Yeah, there's certainly a lot. Certainly one of the biggest issues is that balkanization of authority. It's really hard, you know, let me use the Board of Health as an example. You could certainly go to town meeting. There's no question a town meeting would have the authority to have regulations that look at the entire environmental footprint. Boards of health regulations is really focused on human public health. And so even if it's true that I can come up with a scheme that's that overall reduces nitrogen going to the groundwater, the reality is nitrogen, and I'm sure Cheryl will beat me up, but nitrogen is not a huge public health issue in the state. And so it's a little hard to justify, you know, not pathogens or fluids. So the fact that we have these different areas makes it difficult. The other thing that I think is equally important, it sounds really petty, but at the risk of being petty, we're a home rule state. Municipalities have enormous flexibility in what the regulations are, except for the statutes that are really specific. And so there's these odd, bizarre statutes. I'm working with a community now who wants to have a community conversation about development that goes forward. And it's a small town without staff. And they want to make sure when someone applies for a subdivision, the planning board knows it, the conservation commission knows it, the historical commission knows it, Board of Health knows it. So we can, under state subdivision regulations, tell a developer to give a copy of the subdivision regs to the planning board and the Board of Health. But we can't even make them give a copy of the regulations to the Conservation Commission. We can say, if you don't, we're going to charge you an extra $200 fee. So these odd, bizarre rules of why does the state get involved in that level of detail. And obviously, you know, there's lots of examples of that. So the Zoning Reform Act process is sort of partly that. The Zoning Act was written with lots of different things that just don't fit together.
If I could just add to that, another thing, the big thing I think that cities and towns are missing are resources. They have city and town attorneys whose first answer to everything when you say, can I do this, is no. What they need the technical assistance and the legal education to know just how broad their legal authority is and what they can do. And they don't know it, especially when there's no staff and when they don't have access to the town councils. Yes.
I was just curious, the wetland ordinance seems very in-depth and very analyzed, researched and such. How long did it take you to do that, and what's the size of your staff?
Good question. From what they tell me, it was about 4 or 5 years before I got there 4 years ago. But I've been working on it I worked on it for about 2 years. We held numerous public meetings and educational kind of, we had tons of educational conferences, and we met with environmental groups to discuss it. We met with neighborhood groups. And, I think that took up most of the time. The research was there, the permits were all there. I guess it was mostly the idea, which took a while to come up with, and that came out of the Sustainable Northampton planning process. So I would say about 2 years total.
I wonder if Wayne and Bruce can talk about the situation at the Meadowbrook Apartments. This is a development, about a third of which is built within 50 feet of a wetland, and they've had problems with moisture intrusion and mold. What went wrong at Meadowbrook?
I don't know the details enough.
Yeah.
So
I think that's a project that happened 30 or 40 years ago. I'm not quite familiar with it.
Also for Bruce and Wayne, this idea of the differential wetlands bylaw based on zoning districts, is that something that you were aware was being done in other towns or cities in the state? And have you had inquiries about other towns wanting to replicate it? The other piece of that question is, I'm curious in the community process, was there any, at the end of the day, noise about litigation or people saying you're treating landowners differentially? And do you see that as any kind of a threat, or is there some good counter to that potential legal threat? And then last piece of that, Wayne, I think you were implying, but I'm not sure, that you might also be having differential LID regs based on zoning district. And maybe you could just say a little bit more about that.
Let me start with Bruce. I'm not aware of what other communities have done for wetlands regulations. Bruce may know more details than I do. I think there is an increasing interest, though, in looking at non-zoning regulations and not treating the town all the same. I mean, we used to always think environmental stuff's really important, we should treat everybody the same, and there's more interest in that. I know, as I mentioned, I'm working subdivision regulations in other towns, and it used to be all towns with subdivision regulations throughout. And there's in Western Mass, where a lot of hill towns, there's increasing interest in, we really want to bring back these village centers, they probably should have sidewalks. Sidewalks don't make sense from a hill town context, where homes are half a mile away from each other. So clearly those things that used to be one district-wide, that interest is growing. LID is similar for us. The issue for LID is really just about the density. We have a state hospital that's being redeveloped, and some of the lots in the state hospital are 40 feet long. And there's just challenges. I mean, you can do elements. We were talking about, can we get the water coming off roofs to go into rain gardens or dry wells? So you can do elements of that. But in terms of taking all the street drainage and doing it through LIDs, it's hard to do with that level of development. And so our focus isn't necessarily being, we're probably not going to require LID, at least at this point. We're probably going to be sort of having strong incentives for doing the granite curves. As a practical matter, when you're doing 40 feet of frontage, granite curves aren't a huge cost. When you're doing 175 feet of frontage, it's a huge cost. So I think the market's going to choose the spatial.
I think you answered it. I'm not aware of any other communities that use zoning either, and there hasn't been anyone that has come forward yet with legal concerns. Because part of it is that the commission still has the discretion to go up to determine that a project is it's not a good project, and they can say it still needs to be outside of the wetland buffer. So this is kind of more of guidance for good projects that meet our standards for subdivisions and stormwater and so forth.
As we did look at it, there was a case in North Andover where the Conservation Commission had a policy on how far you had to use the wetlands, and the court didn't like that. And we said, we want to have a policy, we want to let people know up front, and that's really a legislative decision. It shouldn't be up to conservation. We make recommendations, but ultimately we want to go to city council, so it's city council.
Sylvia, last question to that.
Yeah, I just wanted to raise the trees for a minute and turn the conversation a little bit more urban, because in urban areas, we don't have wetlands, but a lot of discussion and disagreement about development and impact on trees and tree canopies in cities and the interplay between that and public health, air quality, but also psychological impacts of those trees. Just wondering if you have any thoughts on that.
Let me start, and then people can kick in. From the public health standpoint, I'm probably not qualified to talk about that, and just share on my own hand. We've done a lot in terms of requiring more trees. We require a street tree every 30 feet, for example, both the subdivision and anything that requires site plan approvals. There's been a lot of focus on that. It's a constant debate about any project where our boards come out, and both the boards and neighborhoods want to say every tree on the site, and wonderful canopy, it's there, it's there. And often sort of what happens in the process is they refocus and say, this is true, these trees are wonderful gems, we hate to lose them. But what are the impacts, again, of where development occurs? If someone can build on the state hospital, a lot that's 40 feet by 100 feet. And we did the state hospitals, we did this detailed survey, identified the big specimen trees that had to be preserved. The entire project was designed around those specimen trees. And then we said, we know that when you're doing a lot that's 40 by 100 feet, except for these trees that you really want to preserve, you're going to lose most of the trees. So in most cases, it's a matter of replanting. In suburban areas where there's more land, we have said, we want you to adjust the road, we want you to adjust the grades, and really save as many as possible. So that's really been our bigger urban things, when we talk about replanting or saving what's there, and even when we're saving what's, even when we're in an urban area, trying to save what's really important.
Do you have regulations on that, or is it really project by project?
We have regulations that require this tree for every 30 feet. We allow it to be averaged, so that's the encouraging that's there. But beyond that, it's project by project.
Okay, this is all the time we have. Thank you for your participation. I apologize we couldn't get to everyone's questions. It's now lunchtime. Please don't forget to do your evaluations. And lunch is going to be upstairs in the same room that you were in earlier this morning in the 3rd floor. And they are requesting that you go to lunch and then go to the exhibition hall after. Thank you. Have a good afternoon.